So now we are going to be switching gears. Now that I've covered pretty exhaustively the question of does this actually work, which was the last training section, the answer to that is yes and, right? And so now we're going to be moving into the Is It Safe series. And this particular module or episode is on safety and contraindications. So when we ask the question, does this actually work? And we say that the answer is yes and, meaning yes, it works, and also it isn't going to work or be appropriate or safe for some individuals. And so that's really the section that I would like to dive into next. So let's start with something that's on everyone's mind. How safe is psilocybin as a substance physically, right? So physical safety. Let's talk about the acute toxicity of psilocybin. There is, first of all, an unreasonably high lethal dose. The median lethal dose, which is also referred to as the LD50, this is the dose at which 50% of subjects would be expected to die. The median lethal dose of psilocybin has not been precisely established in humans, but with animal studies, it suggests that it's quite high. For example, in rats, the LD50 is reported to be around 28 milligrams per kilogram of body weight. So if you do the math on that, for practical purposes, it's not really possible to consume enough psilocybin to actually make it lethal, especially given the fact that most psilocybin is consumed inside of actual mushrooms. So to even be close to this, you would be having to take synthetic psilocybin that is pure psilocybin inside capsules and just swallow a whole bunch. And that's just not how people consume psilocybin, at least by and large, right? So that's the first thing. Second thing, wide safety margin. Psilocybin has a pretty wide safety margin, meaning that the difference between a typical therapeutic dose and a potentially dangerous dose is very, very large. So this also contributes to its relatively low risk of acute toxicity. And then in terms of physical toxicity, right? Psilocybin does not have significant physical toxicity. There are no known cases of fatal poisoning solely due to psilocybin, and it's not considered to be physically addictive or habit forming, as we've talked about in some of the other videos. I am going to address serotonin syndrome in a later section, so just put a pin in that for now. Some physical side effects of consuming large doses of psilocybin, which should not be considered poisoning or overdose. These are just standard side effects because remember that psilocybin mimics serotonin in the body, right? And so some of these side effects can include temporary nausea, a temporary headache, temporary muscle pain, or other physical muscular symptoms such as a heaviness, a tingling, or a burning sensation, the latter of which can happen particularly in the neck, the throat, or the shoulder area. Okay, so those are some of the potential side effects that can happen just from a physical perspective. Now, let's talk about the potential for adverse psychological effects or risks. The most significant risks that are associated with psilocybin are psychological rather than physical. These effects are typically not life-threatening, but they can be distressing, especially with high doses. So proper preparation will significantly reduce this risk from happening, as well as just being in a safe, supportive, quiet environment and with a solid intention and need, right? So this section, especially, I want to dive back into physical safety for a second. This section is not intended to be political or support any particular political viewpoint, but I do want to provide some historical context. I myself am a very, middle of the road type of person, but I do want to educate the public on psilocybin's current status as a Schedule I controlled substance, which is the basis for it being a felony to possess in most areas around the world. Psilocybin is relatively unknown to the modern Western world, at least before the 1950s, although it certainly is no stranger to humanity as a whole, as there is evidence across almost all cultures throughout the totality of human history that humans have utilized psychotropic mushrooms and other substances for various purposes related to culture, ceremony, death, spirituality, and even academia. So, from when it was discovered by Gordon Wasson in 1953 by taking a trip to Mexico until 1970, psilocybin was available and legal in the United States. So, President Nixon is the US president who made psilocybin, cannabis, and a host of other substances illegal in the early 1970s. So for over 50 years, right, it has been illegal in the United States on the claimed basis by Nixon and his administration session that psilocybin has a high potential for abuse and no known medical use. And both of these statements are not true, but regardless, again, it doesn't matter whether something should or shouldn't be. The fact is that it is on the Schedule 1 controlled substance list. So regardless of reasons why or any political motivations, it's way beyond the scope of this video. Both of the above statements are demonstrably false. Psilocybin does not have a high potential for abuse, as we've discussed. It does not work on, it just lacks dopamine-mediated reinforcement, does not work on dopamine at all, and it does have a demonstrated purpose for medical use, right? Through sometimes life-saving mental health treatments. So the reason that psilocybin cannot be abused is because, I think I spoke about this in an earlier video, the serotonergic system will modulate with continued use, and it simply won't work as well or at all if psilocybin is taken too often. I'm going to show a chart next. I'm going to put it up here that shows how classic psychedelics, classic meaning that they're tryptamines that's acting on the serotonergic system, compares with other common drugs, both legal and illicit. So I'd like to make a special note of popular substances of caffeine and alcohol, and then also ketamine on this chart, right? So let's just take a look at that for a moment. And it's important to me to note that, for me to note that psilocybin therapy, while promising, is not suitable for everyone, right? Even though this chart is showing that the physical toxicity is very, very low, the dependence potential is low, the active to lethal dose is very, very low. That's from a purely physical standpoint, but it's not right for everyone medically or in terms of psychiatric conditions. So there are some conditions in which psilocybin can pose significant safety risks. So I want to provide a comprehensive list now of contraindications for receiving psilocybin therapy. Okay, so let's talk about first cardiovascular conditions or fragility in general. With heart disease, individuals who have severe cardiovascular conditions, such as uncontrolled hypertension, severe heart disease, history of heart attacks, that sort of thing, should avoid psilocybin due to the potential for transient increases in heart rate and blood pressure, which are mild and usually well tolerated by healthy individuals. Our litmus test for clients is whether they can safely tolerate mild to moderate exercise. If they are able to, climb a flight of stairs or walk briskly around the block with no problem, then they are probably fine to take psilocybin. But if their doctors have told them to avoid all exercise, avoid raising their heart rate, or if they have uncontrolled high blood pressure, meaning they're not on meds to control it and they know that they have very, very high blood pressure, then psilocybin is not safe for these clients to take. The next one is with liver dysfunction. And this would go with severe kidney dysfunction as well, right? So psilocybin is primarily metabolized in the liver with a little bit in the small intestine as well. So individuals with severe liver disease or liver dysfunction may be at increased risk of adverse effects or just impaired drug metabolism. And this goes with kidneys as well, since kidneys are the ones that excrete substances. If you have a severely impaired kidney, that would be something that we would want to chat with you about. The next category is neurological disorders. So in particular, people with epilepsy. So individuals with a history of epileptic seizures may be at increased risk, as psilocybin can potentially lower the seizure threshold. So careful screening and monitoring are required in this case. And I do also want to mention that psilocybin does not cause seizures in people who do not have a history of those. And then the final thing with neurological conditions is just any other severe condition, right? Such as advanced neurodegenerative diseases, that sort of thing may also warrant caution, and that would be something that we would want to talk with you about. Okay, moving over into psychiatric disorders. Psychosis is the big one. Psilocybin can absolutely make symptoms of psychosis worse or lead to psychotic episodes in individuals with a history of psychotic disorders, such as schizophrenia. It is in fact illegal in Oregon to provide psilocybin services to clients who have ever had psychosis symptoms. Now, some people have had psychosis that was purely drug-induced, right? Or the result of a temporary post-traumatic stress, right? So that's a different situation than someone who has like a cluster A personality disorder, right? With ongoing chronic persistent psychosis or paranoia or delusions, that sort of thing. So that is definitely something to be aware of. I would like to talk about bipolar disorder. This is a mood disorder. This is depression with the presence of also mania, right? So in this case, psilocybin may be at risk of triggering a manic episode. Remember that mania is something that lasts 4 to 7 days, right? It's not the result of normal mood or energy fluctuations throughout the day. It's important to know that psilocybin can temporarily destabilize mood and emotional triggers. We do not accept clients who have a history of manic episodes, but psilocybin can be very helpful in addressing the depressive side of bipolar. So people who have maybe they don't have manic episodes, but maybe they have like low, like hypomania, we might be able to discuss something like that with them. But someone who's had a full-blown manic episode, like bipolar 1, we do not serve. And then in terms of like cluster B personality disorders, in particular borderline, so psilocybin is a destabilizing agent, right, to those with borderline personality disorder, which is already destabilized. Clients with borderline can be treated by our center, but we will often require clients to take lower doses than those without borderline for their own safety, and we may refuse service to some just depending on their active symptoms and their behaviors while interacting with our team. So for example, clients who have displayed aggression towards self or others in the past 12 months, or clients who display chronic dishonesty or concealing behaviors, right? Just trying to get to the yes. If we find out about that, this person would not be eligible to continue through our programs. And this is really not a judgment. This is for the client's own safety because we don't want to make those types of symptoms even worse. Finally, I would like to talk about substance use disorders. So individuals with active substance use disorders or a history of severe substance abuse may have increased risks of adverse effects. We require clients with severe substance use disorders to be in abstinence and not have any withdrawal symptoms prior to beginning their administration session. So for those who just lightly to moderately use substances, even if it's a problem for you because it's become a habit, having a bit of alcohol or cannabis the day before the journey is not going to impact it necessarily. The primary concern that we care about from a safety perspective is withdrawal. We don't want you to be in any sort of withdrawal symptoms that would make your journey more uncomfortable. So that's pretty much it on the physical and psychiatric side, okay? I want to talk a little bit about emotional and psychological safety. Psilocybin can invoke powerful emotional and psychological responses. That is one of the reasons it can be so effective, right? Given this fact, though, it is really best taken under the care of experienced professionals, as we have been discussing throughout this entire training. I have already covered certain severe psychiatric conditions and how they may not be appropriate for psilocybin services, in particular higher doses, which tend to be more destabilizing and can temporarily induce psychosis. For those who do not have borderline disorder, psychosis disorders, or history of mania, which together comprise less than 5% of the new clients I speak to, I want to provide a little more general education for the majority of people out there who are just simply struggling with the more common conditions of depression, anxiety, complex trauma, grief, and/or substance misuse. There is one key concept that I recommend everyone understand, and that is that psilocybin likes having a purpose. So I recommend clients take psilocybin only when they have a clear reason and intention for doing so, something to focus on during the session, right? Even if that intention is vague, like wanting to feel better, wanting to get unstuck, wanting to get clarity around something, it's better to give it a purpose. Experiencing psilocybin without any clear reason or purpose puts clients at greater risk for resistance or other undesired effects like paranoia or fear or preoccupation with death and dying, right? So if you put this differently, psilocybin just wants to be put to work. So when you have a job for it, like healing grief or trauma, it performs admirably. When it wants to be put to work, and you do not let it do its job, the experience can sometimes turn dark and negative. It can feel like something wanting to pull you under the surface of a lake and you are fighting to stay at the surface, right? And it's a little hard to explain the exact mechanism behind this, but the key takeaway is just not to resist the experience itself, even if it begins taking you down a path that you didn't anticipate or want. I do not recommend doing heavy doses of consciousness-altering psilocybin without a clear need or purpose. For those that are looking for a more lighthearted experience without a clear need for healing, we always recommend staying under what would be equivalent of about 1 gram of mushroom of an average potency. In our world, that's about 5 to 7 milligrams of psilocybin analyte. Right, and we're going to get into dosing in another section. But the most effective outcomes that we have had at Fractal have been with clients who have had a focused topic or theme for their journey. We call this working with the medicine, right? You are an active participant in your own journey, and in a way, you're guiding it along with it guiding you. So when people reject their own journeys, thoughts that arise, topics to explore, they tend to experience negative impacts. So the worst thing you really can do is take psilocybin while you're feeling intense fear or dread, or you're feeling resentment towards any element of the experience. Those emotions are likely to be amplified during the session. And this is one of the many reasons why guided preparation with a mentor is crucial to ensure that your mindset is in a good place going into the experience. So of course, some anxious nerves or butterflies are totally normal on the morning of your session, but overall, your mind should be in a calm, hopeful, and mostly open state. There's going to be a bonus training actually that I'm going to walk you through the Fractal Health Self-Assessment Guide and talk about emotional readiness and openness. But I will end this section by just stating that psilocybin works unlike any other medicine or treatment plan out there. It is not meant to be an ongoing thing, at least not in large doses. We want the minimal number of sessions using the minimal dose necessary to achieve a profound experience for you. And for a majority of our clients, that is just one session with a dose of around 24 milligrams. Some clients need the full legal state max dose of 50 milligrams, and others have achieved a profound experience on as little as 8 milligrams. So again, we'll cover dosing in the next section. But we don't recommend more than 3 or 4 large dose journeys in the course of a year or two. And as I said earlier, 1 to 2 journeys usually is sufficient to address a particular mental health goal. Now, before I end this, this is worth mentioning in the safety category, and I want to discuss psychedelic retreats. It is true that in some countries around the world where psilocybin is legalized or decriminalized, and there are retreat type of experiences in these places, right? But it's important to know that retreats do not have the same level of safety or regulation that Oregon's program does and Colorado's program, which is coming online now. Retreat practitioners typically, well, they vary. First of all, this isn't, I'm not trying to just, diss retreats in general. There is a wide variety of very experienced practitioners and not experienced at all practitioners. But regardless, they do not typically potency test their product at the very least. So again, we're going to cover dosing, we're going to cover dosing in the next section, but you really have no idea how much you're taking, because they're going to give it to you in grams of dried mushroom weight, right? Which in the next section, I talk about how dried mushroom by weight has nothing to do with actual dose and actual potency. In addition to this, the standards for facilitator skill and ethics vary greatly, and there's no global board that oversees these things, unlike in Oregon and Colorado, where you will literally lose your license, if something bad happens or you act out of scope, or unethically. And then in addition to this, most retreats don't provide the level of preparation and integration support that's crucial to a long-lasting positive outcome. So, retreats are certainly more safe than doing psilocybin alone, but they are not as safe as the programs developed in Oregon and Colorado. And then on top of the times, they're just ridiculously expensive, right? Not to mention that there's international travel and all of that. So for example, our programs usually around $2,000 for the whole thing, while retreats can often cost upwards of $10K per person. Now, I know that this includes accommodation and all of this, but given the safety and ethical concerns at many of these places, it just makes the endeavor a little bit higher risk and, in addition to being pretty spendy. So again, if it's your goal to go and just enjoy something and have more of a less therapeutic experience and more of a social or bonding experience, that would be a more appropriate place to take to a retreat, and then asking for a lower dose, no more than say a gram to gram and a half is what I would recommend if you're going to a retreat that's dosing you by grams. But if you're getting up into the 3, 4, 5, 6 gram range, you just need to know that could be potentially dangerous for you. So I hope this section on safety and contraindications has given you some hope and not scared you away too much. I just want to reiterate that, we've seen hundreds of clients and we've never experienced a medical emergency, and we've only experienced a behavioral emergency once, and it was for a client who was putting their own safety at risk and who was actually very grateful to us for our care afterwards and still got a lot of benefit from their session. So this doesn't mean that a medical or behavioral emergency can't happen at any time. I just want to reiterate that we're trained for this. And if it does happen, we have specific protocols we follow to ensure client safety before, during, and after their session with us. So next I'm going to talk about dosing and how outcomes and effects can vary greatly based on how much psilocybin you take. At various dose ranges, right, psilocybin can feel like an entirely different substance. So let's dive into that next.